Well, your periods should occur at a pretty regular frequency, especially kind of in your 20s and your 30s, where you're really looking at about 25 to 31 days between periods. If you start to have a lot of bleeding in between periods, you do want to get assessed for that. Sometimes you can have a cycle where it's off cycle and you'll have irregularly timed bleeding. Other times it can be things like fibroids, it could be infection can cause abnormal bleeding. And then when we get into our mature years, let's call them, in your 40s, your periods often become irregular. As you start to go through menopause, you will eventually not have periods any longer, but then if you develop bleeding after that period of time, you definitely need to be assessed. So when you're bleeding, how frequently you're bleeding, at the age you're bleeding are really what you're going to use to determine what you need to do next.